Welcome back. Now, over the last 200 years, it's killed more than 1 billion people, more than malaria, HIV and AIDS, influenza, cholera, and the plague combined. It is the oldest and top infectious disease killer in the world. We can call it COVID-19's older cousin. I'm talking about tuberculosis, or as it is more popularly known, TB. Though it has been on the decline, cases are still prevalent. In fact, in 2017, 10 million cases were recorded. Now, here in Kenya, it is the fourth leading cause of death, killing on average 52 people a day. Now, since the onset of the COVID-19 pandemic, detection and treatment of TB cases in the country have taken a hit, as have many other conditions. Factors like similarities in symptoms with COVID-19, stigma, and declining clinic visits are making experts very worried. What happens after COVID-19 is no more. What gains in the TB fight have been eroded in the last few months, and how much more at risk is the general population with 2 respiratory viruses floating in the air? Joining me now to answer these questions are Dr. Lorraine Mugambi, a TB expert, and Bernard Siele, a TB patient as well as a software developer. Thank you both for joining me this evening. Let me begin with you, Dr. Lorraine. When we're talking about the prevalence of tuberculosis in Kenya, what does that picture look like?
Good evening, Victoria. It's good to be here. Indeed, Kenya is among 14 high-burden countries for tuberculosis, TB, HIV, and multi-drug resistant TB. In 2016, Kenya conducted a prevalence survey, which helped us understand better the TB numbers in the country, and we were able to note that we were missing more than 50% of people with tuberculosis within the communities. This prevalence survey also showed us that we have approximately over 400 people per 100,000 in our population with tuberculosis. What that means is that for every 100,000 people in the population, almost 400, 500 actually have tuberculosis. And this is despite the fact that TB is both preventable and curable.
Okay, so how would someone know that they actually have TB and not COVID-19, considering that the symptoms are pretty similar? How does it manifest?
Okay, so indeed, tuberculosis and COVID-19 do have similarities in the way they present, in the way they are transmitted. And so at the moment, it is possible for someone to have tuberculosis and very easily be tested for COVID without thinking too much about tuberculosis. Both diseases do present with cough, with fever, and for tuberculosis, particularly at later stages, it does present with shortness of breath. For COVID, it's an acute disease. What that means is that between infection and manifestation of symptoms, these symptoms begin showing themselves a lot sooner, within 5 to 14 days, while for tuberculosis, the symptoms develop and progress over time. And so for most patients, by the time they get diagnosed, these symptoms may have lasted for weeks and for some even months. The unfortunate thing is when the disease has lasted for a longer period, that is tuberculosis, then the chances are patients will be presenting themselves to the health facilities with very severe disease, and for some, they would usually pass away as a result of the disease.
Okay, Bernard, let me bring you in. This is your second bout with TB. Your first experience was when you were in high school, I believe. Before you started to show symptoms, what was happening before you went for treatment this second time around? Because you were diagnosed in May?
Yes, I was diagnosed in May. But before I went for the treatment, or actually the test, I had experienced challenges whereby I would cough so bad, especially at night, and it reached a point where I lost appetite, and I could not, even my weight had really gone down. Yeah.
And what's your treatment regimen like? Because, you know, considering how long it takes to treat TB, it's about 6 months. How has it been?
It's been right now. It's been soft. The reason being is I have stick to a schedule whereby I do not want it to become like the second time whereby it will recur. So it has been that every day at 3 p.m. I have to take the medication. So I've set an alarm that reminds me about it, and when immediately it goes off, I have to stop everything I was doing, even if I was walking, to take the medication. Yeah.
So what's the difference between the last time you had it and this time? You've mentioned you're a bit more consistent. What's the difference for you?
The difference right now, I actually have my wife who is around me. So every time it gets to 3 p.m., she reminds me, and she's actually ready beside me with a glass of water and the medication. But also the difference is this time round, I have a flexible schedule. Previously, I was taking the medication in the morning at 9 o'clock. And since I was still in school, sometimes I would miss it since I had to be in class. So right now it's actually better. I have right now the time is really good. I mean the timing.
Right, and another difference is you're treating yourself in the middle of a pandemic for a virus that is similar to TB, and the fact is you are at risk of contracting it. Does it scare you at all, considering what you're having to deal with?
No, it doesn't scare me. However, I have to really take the measures put the measures into place, because when we are going out, even maybe we are going even to pick more, to collect more medication, I have to put on a mask. Sometimes I have to avoid interacting with people. Sometimes I even have to make sure that I'm in a well-ventilated place. So it's more like a matter of taking precautions as opposed to maybe being careless about it.
Right. Dr. Lorraine, let me bring you in, because since the pandemic hit, TB is not the only condition that has been affected in terms of getting less attention. But what has the issue been? What's the impact been of the pandemic on those seeking treatment, trying to access medication, or even to get tested for TB?
Okay. Absolutely. With the COVID pandemic, there has been a lot more focus on it. And therefore, because of that, there has been less focus on other diseases that normally do cause a lot of, morbidity and mortality, in this case, tuberculosis. What we have seen is several impacts at various levels. At community and patient level, we've seen a reduction in health-seeking behavior with patients who have respiratory symptoms such as cough, fever, afraid to visit health facilities. The current stigma that exists, whereby most patients with these kind of symptoms are viewed as possible COVID cases, has made many patients afraid to visit health facilities when they do have this kind of symptoms. We've also seen a lot of patients referring themselves from facilities where they were seeking care and possibly moving to the rural areas, and others stopping treatment altogether because they are afraid of coming back to the health facilities because of the possibility of being viewed as COVID patients. Then at the health system level, we've seen, unfortunately, closure of some outpatient facilities whereby maybe there were some healthcare workers who have been tested with COVID. And so as a result, these facilities that would normally offer care for other diseases have been not available or accessible to patients. And then, of course, because resources are limited, and we do realize that the COVID pandemic does require a little focus, we've seen some facilities that were initially providing TB care being sort of directed towards COVID care, particularly isolation facilities. And then, of course, TB clinicians being moved to support COVID testing and care. So this has really impacted TB care, TB prevention efforts, and we are concerned that we are likely to lose some of the gains that we've made over the years as far as TB prevention and care is concerned.
Let me ask this. What are the risks if someone interrupts their medication regimen? For instance, if they're on a 6-month or a year-long, like you mentioned, some people have had to go maybe up country, and so they don't have access to the clinics or the medication. What happens in that case?
Okay. So first of all, tuberculosis is treated for 6 months, especially tuberculosis that is not complicated. And usually for most patients, after they are initiated on treatment, within the first 2 to 3 or even 4 weeks of treatment, they begin feeling better. And so we've noted that some of these patients stop treatment by themselves. And then again, because of the COVID situation, we've had cases where TB patients who've been on treatment have decided to stop treatment, stop taking the drugs by themselves. Some of the effects that we get as a result of stopping treatment include the fact that the disease may progress, and therefore where you had stopped experiencing the symptoms of tuberculosis, you continue experiencing the same. You may develop complications from tuberculosis. Your lungs may become damaged. And then even as this progresses, there's a possibility that this kind of patients may actually die. Additionally, as the TB disease progresses, there's infection going on. And so these patients continue being infectious, particularly to their household contacts and also their work relations or people that they, normally interact with. And then, of course, there's the other effect of stopping medication, which is development of multi-drug resistant TB. This is the kind of TB whereby the bacteria that causes tuberculosis ceases to respond to the first-line TB drugs that most TB patients are initiated on, and that particular type of disease is very complicated. The treatment is a lot longer, sometimes more than 1 year. They require more drugs for treatment, and unfortunately, many of these patients actually do die. Yeah.
Bernard, let me bring you in. When it comes to stigma, has that been an issue for you at all?
Not really, but I remember when I contracted, when I went to the hospital the first time, my family kept asking me whether it's COVID-19 or it's actually TB that I have diagnosed with. And I remember also my colleagues, whenever I tell them that I'm going to facility to collect more medication, that they really take care of COVID-19. So that has been the situation. Yeah.
And how are you keeping yourself safe, and I guess also the people around you, so you don't spread to your loved ones or friends?
Yeah, so we have ensured that our home is well ventilated, and then of course when we are walking, I make sure that I have my mask on, and then I keep social distance, and of course the main thing is to avoid unnecessary movement. So I only move when it's completely necessary. Yeah.
And Dr. Lorraine, there was talk and reports of the BCG vaccine, which is usually given to children for TB, and them saying that this was a preventative measure against COVID-19. What are your thoughts on that?
Okay. So the BCG vaccine was developed over 100 years ago, and this particular vaccine was developed to ensure that patients who are infected with tuberculosis, or rather for patients who have been given this particular vaccine, that they do not experience severe types of tuberculosis. The way this particular vaccine works is that a small quantity of the bacteria that causes tuberculosis is introduced into your body, and then your body develops immunity or antibodies that are able to fight tuberculosis should you catch or contract the disease. So the BCG vaccine is given particularly in high-burden countries such as Kenya to ensure that should patients contract tuberculosis, they then do not develop severer forms of TB, particularly TB meningitis in children. Now, over the years, it has been postulated, and there have been a few studies showing that the BCG vaccine does protect against certain viruses that cause different types of flus. And there has been heated debate about whether this particular vaccine is able to protect against tuberculosis. The debates have been there, and there have been certain studies that are currently ongoing. However, as at April 2020, the World Health Organization had sent out a statement saying that at the moment, There is no proper study that has been done that proves that the BCG vaccine is able to protect against the COVID virus.
Okay, and moving forward, what can be done, considering that, they are pretty similar? One is acute, one is chronic. But in terms of efforts and response, how can that be synergized to respond to both COVID-19 and TB?
Okay. So the response in terms of ensuring that we actually ride or leverage on all the resources that are currently directed towards the COVID-19 pandemic can be addressed in different ways. At individual and community level, I think it's important that all Kenyans know that, first of all, TB does still exist, and that the symptoms of TB are pretty similar to those of COVID, in that one would present with cough, with fever, with night sweats, poor weight gain in children, weight loss in adults, and so forth. And so knowing those symptoms is pretty important, so that patients, when they do experience these symptoms, they should present themselves to health facilities, and they should demand for TB testing, even as healthcare workers provide COVID testing. So that is at individual level. At community level, there's need to ensure that we support TB patients. It's important to make sure that we do not stigmatize this kind of patients, because what would happen is that patients start hiding their disease and they are not then able to access services as they ought to. At health system level, it's important that we ensure that as we see these patients who come in with respiratory symptoms, that we test them. As we test them for COVID-19, that we also screen and test them for tuberculosis. This therefore ensures that we do not miss these patients within the health system. At national level, healthcare workers need to be adequately supported to ensure that TB patients are not lost within the health system, that case finding continues, that testing continues, that patients are provided with their drugs, their medication as they ought to, and that there is no loss in ensuring that drugs are availed to the health facilities. Yeah, and lastly, it's important to ensure that healthcare workers are also protected, availing to them personal protective equipment to take care of them, even as they take care of our TB patients, particularly drug-resistant TB patients.
All right, Bernard, the last word goes to you. What kind of support, as someone who is managing this disease, would you require from health facilities? And also, what would you want Kenyans to know about managing such a disease and how to keep themselves safe at this time?
Yeah, thank you. The support that is really needed is to have people around them to be there for them, especially to ensure that they take the medication on schedule and at the right time. Something else is to have the facilities be open at all times for TB patients. I remember a time when I went to the health center, which is West Health Center, and I found the place had been closed. So I had called my nurse, and she rescheduled my visits to the next day. When I got there the next day, at least I was able to collect my medication. So as to what I would like the Kenyans to know, that if anyone has had maybe persistent cough, which has gone on for maybe more than a month, or even mostly it should be 3 weeks, let them go for the TB test, because mine was a matter of I had experienced the symptoms for more than a year, and that's really bad. The problem is I didn't know that it was TB. And after doing the test, I was able now to start the treatment. And something I would like to encourage is that TB is curable, so I've seen great improvements in my body since I started taking the medication. An example is that I've gained weight and my appetite has come back. And something else is that I let them not fear, because for me, I remember one of the reasons I didn't want to go to the facilities is that I was fearing that it could be 19. But eventually I had to go because the situation had gotten worse. So that's my encouragement in Kenyans, especially once experiencing such symptoms.
Great, and great advice there. Thank you so much, Bernard and Dr. Lorraine. And correct me if I'm wrong, Dr. Lorraine, the TB tests are free in public health facilities?
Absolutely. Indeed, Victoria, the TB testing within the public health facilities is free of charge. TB treatment as well is free of charge to all patients within the public facilities. Yes.
All right. Thank you so much to you both for your insights and sharing as well. On that note, let's take a short break here on